When I think about Dr. Naito retiring, is all the people's lives that he's touched, generations of people. And he'll be so missed, and he's such a great doctor, and he just deserves the best care, and I just hope he gets it, and he lives a long, happy life and has a great retirement.
Dr. Naito, he loves his older patients, and he would brag about having the oldest population of patients. He had a lot of 90-year-olds and beyond.
I think we're just very lucky that Dr. Naito followed his heart, went into medicine, and he's our brilliant care provider.
He put the health of his patient as a number one priority in our relationship.
Over the last 5 or 6 years, I've gotten to know Dr. Naito in a patient-clinic relationship because I attend all of my dad's medical appointments, and I just have nothing but the greatest things to say about Dr. Naito, and also all the members of his staff. Karen is his right arm nurse. I've gotten to know her very well over the years, and the ladies who help out in the COAG clinic, the care has been 100% fabulous, and Dad's gotten to know many of the COAG nurses over the years too.
His patients love him, and they are going to have, they keep saying to me they'll have a hard time finding another doctor.
He comes into the room, brightens it up. I also appreciate his reluctance to prescribe pharmaceuticals when it's not necessary.
I have to say, in the last 33 years, the reputation and the quality of care delivered at the Portland Clinic, to a large extent, was a reflection of Dr. Naito's attitude and the way he handled his own patients. So he had a major, major impact on the clinic.
On behalf of the Portland Clinic Foundation, I'm just so grateful for his support and for his generosity and for his advocacy, but really as a Portlander writ large, I'm just so grateful for his work in the community. So, you know, a huge congratulations to a wonderful career, and I'm just honored to work with him.
A lot of people have difficulty going to see their doctor. They don't look forward to it. I loved going to see Dr. Naito. He was very personable, enjoyable. For me, epitomized what a good doctor would be about. He was smart, caring, thorough, professional, and an advocate for me in trying to navigate through the complex web of the medical field, and a guy that clearly loved what he did.
So time after time, I could feel his brain working on that analysis, working on that diagnosis, making sure he was getting it exactly right. Never a compromise, never too fast, taking all the time he needed to ask the questions to find out what I needed for medical service.
I'd ask him a question, and 15 minutes later, I would have case presentations, I'd have research, I'd have anecdotes, I'd have articles, I'd have all the latest studies. The only thing I wouldn't have was the answer. But ultimately, that is the best way to teach. And I learned a lot, an awful lot from him.
Dr. Naito, I can't thank you enough for teaching me so many things too long to list. You've been my mentor since I've started here in your office and in COAG. Thanks to you, I'm a better nurse overall, thanks to everything you have taught me. And I will miss you.
I'm Kathy Liss. I'm a medical assistant at the Portland Clinic, working with Dr. Naito. I'd like to thank him for all the work that he's done over the years for so many people, including myself, and it's been a pleasure to work with him.
We shared our passion for excellent patient care. We shared the willingness to fight for what we thought was right. We didn't always agree on what's right, but we always agreed that we should do the right thing the right thing for our patients, the right thing for the clinic as an organization, and the right thing for our employees and our partners.
It was always a challenge when Ron would come to me and ask a question. He wasn't really asking a question. Normally it was, well, Albert, you know from the Journal of Forensic Clinical GI Immunology 2 months ago that so-and-so and this happens. And I'd have to say, usually, no, Ron, that's not a journal that I regularly read, but I will look into that. Thank you for your good, interesting question. And I'll have to try to really live up to the academic excellence that he lived and that he established for all of us to try to follow.
He has such dedication, and I have talked to many of his patients in the last few weeks, and I'm learning that he practiced with a lot of heart. His patients truly feel like they have been cared for and tremendously well. And they are sad to see him retire, but life moves on, and they just want him to know that they're thinking of him.
Hello, Dr. Naito.
Gene and Rayal here. We appreciate the care that you have given us over the past 30 plus years. Thank you very much.
We wish you the very best going forward. Our thoughts are with you.
Hi, I'm Tina Mondragon. This is Catherine, and this is Stephanie. We all work with Ron Naito in the internal medicine department downtown. We are given few opportunities to really express how we feel about most people in our lives, maybe beyond those we call family and maybe our closest friends. We have even fewer opportunities to speak our truest sentiments to those who have mentored us, as oftentimes we don't realize who these mentors are until long after we or they have moved on. And so this moment and this time with you, Ron, is quite special, and more so, truly an amazing gift that you've given us.
The dean of student activities at my medical school retired the year I graduated. An auditorium full of people gave him a standing ovation. It was a very powerful moment. We, the staff and the patients, are giving Dr. Naito a standing ovation now. We want him to know how much his work has meant, because we see his patients, and through them we've learned more about him every single day. And they are devoted to Dr. Naito. And one patient even said to me just the other day, without Dr. Naito, I wouldn't be here. He saved my life.
Thank you, Dr. Naito, for all your amazing care to your patients throughout the years. They appreciate you so much, and every day I hear of how you've impacted their lives.
I've known Dr. Naito for 30 years as a colleague, as my doctor, as my friend. Dr. Naito's always been there for me. If I had a question about a cardiology patient, I could always go to him. He would give me an answer. He'd give me an explanation for the answer. And I learned so much from him. And as my doctor, I appreciated the care that he gave me always, including my recent car wreck, black eye, concussion. So he was there for me, and I'm gonna miss him.
Personal care. Every time I went to see him, you could tell that he was giving me the personal care I needed to have.
The best piece of advice Dr. Naito ever gave me, I have passed along to every co-ag nurse in the department. I've passed it along to my kids and my grandkids. He told me one time, just don't do anything stupid, Becky.
And so it's wonderful to have this opportunity to say, thank you for all your wonderful care. We couldn't be here without you, and all the best.
At this time, all of us are here to support him in everywhere we can, and certainly offer him all the prayers that we have to offer.
He's just there. I mean, it's what you get is what you see is what you get. I mean, he's awesome. He's got so many great characteristics.
Well, I think about the poem by Dylan Thomas that he wrote to his father when he was terminally ill. And do not go gently into the good night. But to finish, I think that I would like to perhaps quote from Robert Frost and one of his favorite poems. The woods are lovely, dark, and deep. And I have promises to keep and miles to go before I sleep.